The ICF Training and Technical Assistance team is honored to welcome you to this California Housing and Community Development Training session offered through the Emergency Solutions Grant, Coronavirus Relief Consulting and Staffing Services Contract. My name is Chris Pitcher from ICF. I'll be hosting today's session. Today's session is part of our community workshop series. This one is our first in a series of 3 on the effective non-congregate shelter. It's my privilege to introduce our first presenter today. That is Nora Breslin. Nora.
Awesome. Thanks, Chris. So today, as Chris mentioned, we're going to be talking about non-congregate shelter. And just a heads up, we're going to be referring to non-congregate shelter as NCS throughout the presentation. So apologies for that abbreviation, but I definitely think it makes the slides a little more accessible to frame it that way. So we're going to be doing a quick round of welcome and introductions, and then we're going to talk a little bit about what non-congregate shelter is, why it might make sense for your community to continue using non-congregate shelter or implement a new non-congregate shelter program or project. And then we're going to talk a little bit about implementation. And also, if your community doesn't have the funding or community buy-in or willingness to stand up or continue an NCS project, we're going to really talk through some examples of how you can incorporate some of the best practices and things that really worked well from NCS into a congregate environment or encampment environment. And then we're going to walk through some community examples of folks that have implemented pretty successful NCS projects with strong outcomes and exits to permanent housing. And then we'll talk through a little bit what's coming up in our next sessions. If you have questions, please feel free to raise your virtual hand, or you can throw it in the chat. We'll be monitoring the chat and we will follow up with your questions there. Next slide, please. So a quick introduction from our presenters today. My name is Nora Breslin. I work for an organization called Home Base. We're based in the Bay Area, and we do technical assistance in California, across the country. And so I will pass it over to my co-presenter, Donald. Go ahead, Donald.
Good afternoon. Donald Whitehead. I am a co-founder of Racial Equity Partners, and we have been working with ICF and our other partners here to present on various topics in the state of California. Also wear a second hat, I'll refer to that a bit. I am also the executive director of the National Coalition for the Homeless. And I will pass it on to our third presenter.
Hi, thanks so much. My name is Ashley Kerr. I use she, her pronouns. I am a subcontractor for ICF and have been in the technical assistance world for about 15 years. Really happy to be here today and have had the opportunity to talk with a number of communities about non-congregate shelter. So really excited to bring this information to California and looking forward to our conversation. Thanks.
Thanks, Donald and Ashley. So next slide, please. Chris prompted everyone to put your name, your pronouns, and your organization in the chat. So if you can continue to do that, that would be great. But we're also going to do a really quick poll to get a sense of who is in the room. So thanks, LaQuantia, for launching that poll. We have a few options: shelter team member, COC lead agency, public health partner, or other. If you're another type of provider, a person with lived experience, if you can let us know in the chat, that would be great. And we'll give that just about 20 to 30 more seconds.
Thanks, Nora. And I noticed in the chat, there are a couple of folks who are setting up, we had in Reading a micro shelter, and Chico, a tiny home, innovative emergency shelter to tiny homes. So there are some interesting folks joining us that don't necessarily fit into these boxes, but definitely might have some very good things to share with us today.
Yeah, that's great. And now that you've exposed that, I may call on you later in the presentation and have you share on some of those efforts, because that could be really helpful for other folks to hear as well. So it looks like, LaQuantia, I think we can end the poll. Looks like mostly shelter team members and COC lead agencies. And then we have a pretty about 40% who define themselves as other. So it sounds like from the chat, other providers and folks doing some non-traditional shelter and housing projects. Great. So as Chris mentioned, we're doing 3 different sessions related to non-congregate shelter. The first today is 90 minutes, and it's really meant to give an overview of non-congregate shelter and best practices. Our second session is really going to focus on prioritization. So for folks who are carrying their non-congregate shelter projects or starting new projects post-COVID, thinking about what makes sense in terms of how to prioritize folks for non-congregate shelter versus congregate shelter. So we're going to take a deep dive into that. And then for session 3, we're thinking that we'll have some folks who are standing up non-congregate shelter projects currently and moving those forward, come in and take a really deep dive into what that's looking like for them, how they funded it, the ins and outs of that. Wondering though, since we have some flexibility in that third session, does anyone have any, we can also have it be more of an office hour session where we're helping you work through and brainstorm issues that are coming up in your community related to non-congregate shelter. So I just want to give it 1 minute in the chat. If you have any ideas for topics or things that would be really helpful for us to talk about in that third session, please feel free to put it in the chat and we can try to incorporate that to make sure it's as responsive to your needs as possible. Next slide, Ashley. All right, I'm going to pass it over to Donald to talk a little bit about what non-congregate shelter is, and please keep adding things to the chat. We'll monitor that.
Thank you, Nora. Thank you for framing our upcoming discussions and the work we'll be doing today. So just want to give a little context and define in more detail what we are talking about when we talk about non-congregate shelter. NCS, as has been abbreviated earlier, is a location where an individual or household has a living space that offers privacy, such as a hotel or motel, a dormitory, a retreat camp, a decommissioned nursing home, or other locations that have private rooms, as opposed to the congregate setting, which incorporates a setting that there may be as many as 200 to 300 people in a space that is considered emergency shelter. The use of hotel and motel rooms as emergency shelters is not new, but were used sparingly in the past. What we saw over the course of our experience with COVID is that because of the underlying health conditions of people that experience homelessness, many communities decided with direction from the CDC and other providers to move people from that larger setting where they were susceptible to disease into different spaces. And there was also resources provided through COVID relief funds and other funds that communities decided to utilize themselves. Many communities that weren't usually in the practice of using these kinds of settings moved to use these kinds of settings. So next slide, please. So what a non-congregate or NCS offers is a humane approach to sheltering. It minimizes the trauma that may come from being in situations where there are numerous individuals with numerous behavioral health issues at times, where there are people that may be susceptible to victimization. That trauma that occurs when an individual enters into these settings is minimized when they have their own spaces. It also offers privacy and safety through the use of individual rooms and bathrooms. Many of our congregate settings don't have individualized spaces. Bathrooms can be a particular issue when it comes to people being able to thrive and survive in those settings. So the privacy that's offered in some of the other settings that we talked about is incredibly important to the long-term health and the progression of people through the shelter system. And again, it improves health. less opportunity to contract communicable diseases, flu, strep, and pests like lice and bed bugs, and even some more serious issues that are health related within the shelter system. That division of people in the private spaces really mitigate some of these common issues that people face. The NCS model was highly effective for vulnerable populations that don't feel safe in traditional shelter environments. And some of those are Black, Indigenous, and people of color, families, people in domestic violence situations, people with various abilities or disabilities that may be victimized in some of these settings. There are also LGBTQI individuals who are sometimes victimized and ostracized in shelter settings. There's a lot of research that says that these populations are less vulnerable and in these kinds of non-congregate environments. There was a question in the chat about research around this. There's research around this, but there's also research and feedback from the populations themselves. So I'll go into a little of that with our next slide. So as a product of, a byproduct of kind of this transformation and some of the things we saw, we were able to see that there were a lot of really positive outcomes when we moved to these non-congregate settings. We worked on reimagining shelter. It's a project that involves most of the national advocacy organizations. As I said in my introduction, I'm also the director of the National Coalition for the Homeless, but we worked with the National Alliance to End Homelessness, the National Healthcare for the Homeless, the National Coalition for Housing Justice. I can go on, but there's many, and also the Urban Institute. And what we did is we wanted to understand how people who were in shelters, what their opinions of both the non-congregate and the congregate setting. And so we had a series of listening sessions across 17 cities and the District of Columbia. We had a diverse group of individuals that we talked to. And I think it's really, really important that as we think about standing up non-congregate shelters, that we really listen to those who are in those settings every day and how they are affected and what they think. And so we entered into this process. We did focus groups. We also did key informant interviews with people. And these are some of the findings that come from those who are affected. If we go to the next slide. So we asked them what were some of the qualities and values for shelter. And one of the things, they were overwhelmingly concerned with safety and service delivery. And many respondents responded that safety was the reason they avoided shelters. So we also believe a byproduct of transforming to a non-congregate setting will be the reduction of unsheltered homelessness, because many people, as was found in these interviews, avoid shelters because of safety and quality of service concerns. There was a really overwhelming response that there needed to be more services, and in particular, case management and other services like housing search and housing navigation. There was also a need for more resources around income, and we know that there is a challenge in getting those additional resources in the shelter system. But there, from the participants, there is a need to do that. So here are some of the things that really were there. There was a lot of conversation about just the cleanliness and health issues inside the shelter system, and a need to really work harder on that in the shelter system. Now, again, in a non-congregate setting, you remove that barrier, that issue for people experiencing homelessness. So we go to the next slide, please. We also looked at what was working, and some of those examples of non-congregate shelters that we talked about. A hotel, a former nursing home, a former school was one that wasn't there, but that was also something that was actually given to us as a response by the participants. So locked doors, private showers, private refrigerators were things that were expressed, and just a gratitude for those that were able to isolate during COVID. The opportunity to meet case managers was enhanced, and we saw better outcomes when people were in these non-congregate facilities. And so there was a lot of unanimity about hotels and motels being a great idea. So next slide, please. So what didn't work well is that when some of us approached this, and I've seen this in a few communities, room sharing with people who had no relationship with each other was something that the participants didn't think worked well. The absence of staff, not staffing up a non-congregate shelter is an issue for people that were in the shelter. Better programming, and those elements we talked about, housing navigators, additional case management, and there was also a need for navigation out of the shelter. And many people expressed a real deep disappointment that after being put in the non-congregate setting, after funding wasn't on the table anymore, a lot of people returned to the previous setting. And so if we can go to the next slide, please. Okay, so when we reimagine what shelter can be, we need to listen to those who have experienced the shelter system and incorporate their ideas and suggestions. Safe, sanitary, and secure spaces are the basic minimum, and the basic minimum physical shelter characteristic. Tailored case management is critical to support individual success and movement to permanent housing. So in a nutshell, what they're saying to us is we need to improve services, we need to expand services, and we need to make sure that the spaces that we are utilizing are spaces that we would basically live in ourselves. And so I'm going to move on to our next slide, and that's we're going to move on to Ashley at this point. Thank you,
Thanks
Ashley.
so much. Thanks. Really appreciate that grounding in the voices of people with lived experience. So placing individuals in a hotel room or a dormitory is not enough, right? Shelter providers need to think about and consider a number of factors to ensure a successful isolation experience for the people that they are serving. So let's start to talk about the physical attributes of non-congregate shelter, which are in addition to individual rooms with private bathrooms. So individual households should have their own room. If it is a larger family unit, think about if you're in a hotel space using adjoining rooms, or if you're in a dormitory, one that has multiple bedrooms. There need to be clear signage in designating the isolation areas. So thinking about entrance and exit pathways. Are there stairwells or a particular elevator that can be designated for individuals who are entering and exiting the hotel or dormitory floor that minimizes contact with individuals who are not in isolation? So really thinking about the spatial qualities and the spatial needs for isolation and non-isolation areas of a building. Of course, you're going to need to really think about and up the cleaning and disinfecting regimen. So really considering bringing in professional staff who can be retained on a regular basis to have the cleaning and disinfecting regimen in place for all common areas, but also in the private rooms. And then having the HVAC being controlled at the individual unit level really allows the household to keep the temperature where they are most comfortable. Before we move on, I really want to emphasize what having your own space really means. And I want to go back to thinking about some of the comments that were on the slides that Donald reviewed. But having your own space means that you get to take a bath or a shower whenever you want. You get to choose what to wear, or if you don't wear clothes, because it's a private space for you. It allows you to watch TV when you want and what you want, right? It's not chosen for you. And people are able to sleep without fear of attack or the noises that accompany a congregate living space. So it allows folks to really have a space where they can heal and do that with dignity. So please keep that in mind. Also, all of the comments that Donald talked about from those listening sessions, as we really work through these conversations about non-congregate shelter and how we want to think about making shelter a more humane and dignified space for people to recover and thrive. So many individuals have animals, including pets and emotional support or service animals. So an NCS space has to consider the availability and accessibility of outdoor areas where animals can go for toileting and for exercise. This issue may have to be navigated in an NCS space if a hotel or motel does not typically allow animals. So that's a major consideration to, again, think about the humane space here of pets, service animals, and emotional support animals are part of that household. Another issue to consider is a person's belongings. So folks may have a lot of stuff, and there may be bikes, there may be carts or wagons that help them move their belongings from place to place. So does the building have a secure room or a bike rack that is both secure and also monitored? When we were having conversations back in the day about trying to vaccinate folks who were unsheltered, we had our initial plans were that the belongings would be in a location further away from the vaccination site. And what we were informed by people who had lived experience is that they wanted to have a clear sight line to their belongings at all times. So thinking about what that means and having those conversations with folks about their belongings when they go into non-congregate shelter will be really important for a successful transition into NCS. Another thing to think about for storage is related to food. So if individuals have food in their rooms, that the shelter provider really does need to think about making sure there are Ziploc bags and or other food storage like Rubbermaid stuff or Tupperware or anything that you've got that can handle and keep food secure and closed to really minimize any issues with pest control. That's going to benefit both the person who is staying in that space and also the building at large. Also, many individuals have appointments that they must keep. They may have jobs, they may have school that they need to attend. So thinking about a location that has public transportation is really key here. But of course, not every place has public transportation. I live in Alabama and public transportation is few and far between here. So thinking about other options. Does the shelter have an account with a ride sharing group that they can provide trips to and from the appointments and the different places where people need to go? Does the shelter have a van or a number of cars that they can use to help people get to and from where they need to go? So that's a major consideration here. And then outdoor space, right? And we're going to talk a little bit more about outdoor space in a few more slides. And y'all, my fellow colleagues here, I don't have access to the chat right now. So if any questions are coming up related to this, please just shout it out to me. Thanks. Okay.
We're good for right now, Ashley, but we'll let you know.
Thanks, Nora. I appreciate it. So let's talk a little bit about staffing considerations. A successful non-congregate shelter really accounts for the staffing needs of the individuals who are staying in isolation and provides these services to the best extent possible. So ideally, you have staff and services that are co-located at that non-congregate location. So residents really do not have to travel to services and support. So thinking about assigning a room at the non-congregate shelter for both case management meetings and other provider meetings can really allow not only the privacy and the safety for residents to have those meetings, but also really minimizes the time that a staff member goes into individual rooms where people are living. So, right, we are really trying to think about a different way to shelter folks. So if this is their private space, trying to minimize the amount of time we actually go in there really allows more autonomy over that space. When weather permits, have meetings outside. And I recognize that that's really going to be different across the country, right? We're starting to get into some warmer temperatures here in the South. So that might, and of course in California, you all may have some really great temperatures where you can stay outside. That, of course, open air reduces virus transmission and can also just be really good to get some fresh air while you're having conversations. You will, of course, want to think about, if you're having private conversations, places where people are able to be vulnerable and have that privacy to be able to share their emotions and their feelings without people looking on. So, of course, that's a consideration with outdoor space. So, given the risk associated with caring for residents who are sick, thinking about only allowing the essential staff, so these are the individuals who have been assigned to work in the isolation area, only those essential staff should be allowed in the locations, and those that are working in that non-congregate shelter should be fit tested with an N95 mask and prioritized for those types of resources. That is in addition to providing full PPE when staff are working directly with folks who are sick. So when we talk about full PPE, we are talking about a gown, we're talking about gloves, a mask, eye protection, so really the full PPE kit. In addition, you want those staff that are working there to be up to date with their own vaccine series, including any booster shots that they are eligible for. So this is a higher risk situation, so providers need to think about offering hazard pay and other incentives to compensate the staff who are serving in these high risk positions. Last thing I just want to say here on this particular slide about staffing is when residents are going to be with you for 10 days or longer due to isolation, this is really an opportune time to focus on connecting these individuals to services and preparing them for that transition to permanent housing as soon as it is available. So if people are well enough to do so, thinking about conducting your assessments during this time, helping get the paperwork in order, and conducting any remote apartment searching while residents are in isolation can really give you a leg up in the next space of moving folks into permanent housing. Keeping on with the staffing considerations, one of the biggest mistakes that we saw emerge during early implementation of NCS was that there wasn't enough on-site staff. So properly staffing in NCS is really critical to the success of the model. And this includes enough staff to provide both case and crisis management, housing navigation, which is really, again, focused on permanent housing placements, food delivery, supportive services, and security. There was a really great resource published early in the pandemic on staffing needs for high acuity clients or folks that have a lot going on and a lot of challenges in their particular situation at that time. We have included a link to this that is on our resource slide. So you'll be able to access this after the presentation. But You all may be, using that as guide. You may have your own agency or state policies that are guiding you around staff and resident ratios. So just make sure that you are compliant with the policies that exist in your particular community. But the biggest takeaway here is to make sure there are enough staff members there to cover the functions associated with NCS. So let's talk about a couple of those. Residents staying in shelter need support through crisis and case management. So earlier or I guess late in 2022, probably about 3 or 4 months ago, my colleagues and I presented a webinar series focused on housing-based case management. And I would really encourage you to review that series, particularly because the first and second sessions focus on the type of case management that is needed in a shelter setting. We're talking about that obviously in congregate, but this also includes non-congregate shelter spaces. So in shelter, case management is really focused on addressing the immediate health and safety needs of the resident, as well as preparing them and beginning that conversation about permanent housing placement. So for a more in-depth look into case management in a shelter setting, please watch that series, and we put that link to the series on the resources page. Also, connecting folks with supportive services and mainstream resources in the community serves 2 purposes. One, it really helps outsource needed support to community-based partners, but it also expands the residents' network of resources, which is a really important tool in long-term stability once shelter services end. Security is also important, but we really want to think about this from the perspective of what is needed to protect residents and maintain a healthy working relationship with the building being used as NCS. So many hotels and motels have security on staff, and agencies will want to talk with them about what security should look like for people experiencing homelessness. If at all possible, consider these different ideas. Hosting trainings or multiple trainings on trauma-informed care and de-escalation. Eliminating the use of uniforms and any weapons. People should know who the security team is. They should not have to feel afraid, concerned about their own safety because a security guard has a weapon. Also think about the trauma implications of a uniform. For those who have been incarcerated or harmed by someone in uniform, security is there not to re-traumatize, but is there to respect everyone's safety. So really thinking about the physical attributes of the security team. And then put protocol in place for de-escalation and case management interventions before security gets involved. There will be circumstances where security may have to be the first call, but the agreement should be that de-escalation is always the goal here. I also just want to point out that shelter is a life-saving service. So the focus needs to be on stabilizing individuals and providing care for their immediate needs. So for those with active substance use issues, it will be truly critical to coordinate with healthcare service and work with trained professionals who engage in harm reduction strategies with the residents that you are serving. When we are talking about harm reduction strategies, we are typically talking about illegal substance use, but there are additional considerations when there are multiple legal substances that individuals use regularly. And we're talking about California here, so that means we also have to talk about marijuana. So hotels and motels will likely have rules about smoking marijuana or using marijuana in the rooms themselves. I see there is something in the chat, so I bet you there's going to be a conversation about this. So you'll need to follow the building's protocols. But if an agency is using an entire building for NCS and has to develop its own policies regarding marijuana use, consider what is tolerable and what is not tolerable. There may be other forms of marijuana that can be used that won't violate policies. Nora, you came off camera, so I have a feeling that you have a comment or someone does have a comment about this. So I'm going to stop talking for a moment.
Yeah, Good eyes, Ashley. So William asked in the chat if anyone's seen successful programs where security was not used and staff was trained on de-escalation. So, and it seems like Donald might have an example ready to go. Go ahead,
So
Donald.
I was actually typing in the chat to you, William. I operated a shelter in Orlando, Florida, called the Men's Service Center. And our intake and resident management staff was trained in de-escalation. They actually went through crisis intervention, actual certification. And so we used them in their setting as opposed to using security guards. And it worked really well. Obviously, there were incidents, but I think our population was a little bit less threatened. We know that many of our clients have interactions with law enforcement that may be negative, and just using a trauma-informed approach that provides that same level of security, but not the security look was a way that we were really able to one address trauma, but also have a shelter that was really more of a community setting than one that looked like a law enforcement setting. So that shelter had 800 people on campus, and it worked really well. Never ever had a security guard. And there are other examples of that around the country. There are also a lot of examples where security is used, but I personally would prefer to have a staff that's trained in de-escalation, even in the shelters that do have security guards. I think the staff still needs to be trained in de-escalation. So I think it's actually a critical component to any staffing, whether it's a congregate or non-congregate shelter. So just wanted to address that question.
That is amazing. And I'm really thankful that you brought that up, Donald. I've seen a lot of, or not a lot, but I've seen some really good examples too, where the security actually has the exact same, everybody who works at the location has the exact same uniform, and that's like a t-shirt and jeans or khaki pants, right? So that there is no issue around uniforms. Also thinking about how people are entering and exiting the building. So Donald mentioned that they had staff that was trained with de-escalation. I've seen some really good situations in which there's a front desk, and that's where, people have sight lines that can see people at all situations. And so the security folks are there with the team members, and everybody has been trained in de-escalation tactics and techniques. So that's a really important thing to think about here, especially because we have folks that may have some mental health issues or may have had a variety of different run-ins with people that have caused them some harm. So really just appreciate that. Nora, did you want to say something?
Yeah, two things. One, Nettie is asking in the chat the name of the Orlando program. So Donald, if you could throw that in the chat for folks, that would be great. But we also had Amber who commented that she has a 58-bed shelter that trains staff, no on-site security. At a second location, they have 200 beds and a security person at the entrance, but all the staff is trained in staff interactions. So not to call you out, Amber, but if you want to hop off mute and say anything additional about how that program is working or de-escalation training protocols that have been helpful, that would be great.
Yeah, we have similar commitments to, things like de-escalation, motivational interviewing, and just making it so that staff, when difficult situations arise, they are interacting with the same people that are celebrating when good things happen. We're trying to make it so that our staff is meeting people where they are, understanding their situation, because that's the other thing. When you separate security from staff, security often is just thinking about, intervening or stopping a situation. The opportunity to get to know people and establish a rapport, understand the best ways to respond to each individual human, I think are also compromised when you lean too hard into security and you're not utilizing existing staff that does have the time and the opportunity to establish rapport and just get to know people, know the difference between somebody, having a bad day or, having a bad moment or or a crisis. I think we often say here, particularly when we bring in volunteers or community members, we say, what could look like a 911 to you is just a Tuesday for this person. And so I think we're just, when you still certainly need that piece, because sometimes if things escalate, which they do, anytime you get a large number of humans around, right? You have someone who has that authoritative component, but for us, it's a last resort, not an initial response.
And Amber, great point. And I would also say, I also listed the Orlando Coalition for the Homeless, but also the Shelter House in Cincinnati, Ohio, which had the same method of operation. We did have metal detectors. So it wasn't like a completely unsecure location. We just made the decision that we would do that work in-house and using, because in addition to the crisis intervention training, there was also motivational interviewing and all the other kinds of important trainings like trauma-informed care that are important. So even in our discussions with people who had been in the system, these are the things that they're saying. They're saying, they need to be treated more compassionately, that compassion is the way to move people along versus some type of setting. The other thing, and I'll just say this and be quiet, some of these people also are leaving the criminal justice system. And this is their first opportunity to experience the freedom of living in community without community in a carceral setting. And so it's important that we embrace that as well. We know that unfortunately there's a revolving door between the criminal justice system and the homeless system. So I think all of those things are important. So thank you for your example.
Yeah, that was really very helpful. And I would love if we have a couple of minutes at the end, if people have additional questions about that, that we could all come off or take the screen down and we can all see each other and have that conversation. I also love that, the Alabama girl thinks that marijuana was what all the comments were about, and it absolutely wasn't. It was actually about security. So I'll keep talking about harm reduction, and then we'll turn it back over to some great examples for Nora. So also want to talk about cigarettes, right? We know that many individuals smoke, vape, and use other tobacco products. So ensure that the residents know what the building's policies are on tobacco use in guest rooms and have alternate locations where people can go to smoke. But if people are in isolation and unable to go out for cigarettes, assist them in securing their brand or help them get a vape pen. I mean, that is something, we are not here to be pushing smoking cessation at this time, right? Shelter is a life-saving service. And then alcohol. For individuals who are actively using alcohol, and if there's any concern about withdrawals, connecting with a medical professional. So alcohol withdrawal can be life-threatening, and shelter is not the time to go cold turkey. So again, this is a situation for partnership with your medical professionals, so individuals can be comfortable and not concerned about withdrawal symptoms. So I want to emphasize that harm reduction is an approach and one that requires training and support from your medical and public health partners. So please reach out and utilize the expertise of those partners in these situations. Let's talk a little bit about attending to residents' needs. So the privacy of non-congregate shelter may be difficult and possibly triggering for individuals who haven't been in a space like this in quite some time. So especially those who may have some mental health issues going on, or who have been incarcerated and or held against their will at some point in their history, or those who are actively using substances. Really ensuring individuals continue their medications and connect with mental health professionals throughout the isolation period, either through telehealth or through some on-site services, will be really important. But also building upon both the physical attributes of and the staffing considerations for NCS, thinking about other things that people may need. So toiletries, including feminine hygiene products, should be readily available. Plan to restock these rooms regularly with these items, as well as toilet paper, tissues, soap, and clean towels. Providing hand sanitizer will really help reduce virus spread and offer disinfecting wipes so that each household can wipe down their surfaces regularly. Making sure there's a meal service so that all residents who are staying in private rooms have meals and also have snacks and other non-perishable items that can be eaten in between meals. Include water and other beverages such as drinks with electrolytes. And it's also just really difficult to stay in a confined space for a prolonged period of time. So staff really need to think about safe ways that residents can leave their rooms to go outside for a walk or to get some fresh air if they are well enough to do so. So we talked about exit and entrance pathways, but having a designated pathway into and out of the building that can minimize contact with other guests who may not be in isolation, or having a schedule for when guests want to go outside. All of these things can really be super helpful in keeping people in as healthy of a situation as they can while they are in isolation. Just want to point out having books and TV to pass the time. If people are trying to go to school, making sure they have tablets or laptops to be able to attend classes or work remotely. All of this is really important to think about if people are in isolation. And then staff should be watching and trained to look for distress signals from residents. So increased anxiety can set in and can worsen situations of isolation. So really making sure that mental health care is available to those that seek and or may need the support. So I'm going to talk very briefly about funding and how you can actually pay for non-congregate shelter. Then I'm going to turn it over to Nora to talk about some examples. So we know that annual ESG can be used, emergency solutions grants. Many of you know it, ESG from the ESG-CV or the CARES Act money, in which we put a lot of people in hotels and motels. And that money can also be used to clean hotels and motels and repair damages. So there's a lot of ways that both ESG-CV and then annual ESG used for COVID purposes can be super beneficial here for funding. You also have local, state, and private funding, and I'm just going to put HAP there, but there are a number of things, and I'm sure many of you who are working in the system can talk about other funding for non-congregate shelter. But I also want to make sure that people are also thinking about your public health partners. Many public health partners have money for hoteling, for isolation, and to think about that as well. So with that, I'm going to turn it over to Nora. And if y'all have any questions, please put them in the chat. Thanks so much.
Thanks, Ashley. And for folks, if would be helpful to take a deeper dive into funding as a topic, definitely put that down in the chat. I know HIP is something that a lot of communities have as well. That is a super, super flexible source of funding. So if it would be helpful to think through funding alignment and strategies around NCS in a future session, please throw that into the chat. But the main thing I'm going to talk about is incorporating non-congregate shelter best practices. So sort of what Ashley just talked through into congregate shelter and encampment settings, because we really realize, right, like in an ideal world, every community could have NCS and sort of structure it as part of their full system of care, but that's not always possible, right? Either because of funding constraints or, as Heather was mentioning in the chat, you know, she had to fight to even get the non-congregate program, or I'm sorry, the congregate program stood up. So really thinking about how to leverage some of the advantages and benefits of non-congregate shelter and apply those either to congregate shelter or an encampment setting. Another plug I'll put in, I know we have a few COC lead agencies on the line, and the COC application for COC funding from HUD last year had on the application point incentives for communities that are planning non-congregate shelter projects or have sort of like a long-term vision for incorporating non-congregate shelter into their COCs. But I know a lot of folks had at that time had non-congregate shelter sort of winding down. So I think incorporating some of these practices into congregate settings, into encampments, is also something that you can talk about on your COC application to ensure you're getting as many points as possible. All right, next slide, please. So I think one of the things, and Ashley took a pretty deep dive into this, one thing to really think about is during COVID, for folks that did have NCS in place, you really had a lot of strong, or many communities had strong public health partnerships, right? So implementing protocols for disease control, implementing sort of disease control and sanitation best practices, masking, distancing, head to toe sleeping, screening, PPE, contract for sanitation. So some of those infrastructures were sort of built in. And so we would just really encourage you to continue building those relationships and just making sure that those public health partnerships are being carried into your congregate shelter, even after a non-congregate shelter closes, or if you're no longer moving forward with that project type. Making sure, and again, this is something that is scored on the COC application, so something to definitely be thinking about as a community, about designing protocols for folks that have been exposed to infectious disease. And I think another really strong feature of non-congregate shelter is the fact that health services were co-located at those locations. And we'll talk about, I'll briefly address some studies that were done that show that actually had a pretty significant benefit on folks in those projects. So again, thinking about your existing partnerships, how to leverage them and continue them into congregate shelter settings, and then also thinking about building new partnerships if that's not something you had in place during COVID. Next slide, please. So I think Ashley and Donald really talked a lot about this, so I'm not going to touch on it too deeply, but I think part of the huge advantage of non-congregate shelter is that vulnerable populations feel much safer, right, in non-congregate shelter. And so really thinking, again, if that's not an option for your community, how you can make your congregate shelters, any encampments that have infrastructure or staffing associated with them, as inclusive as possible. So we talked a lot about security, right, and how to deal with that and make sure that that's not a barrier for folks. But some other tips I would recommend are, hiring trusted community members and peer workers is a big one, right? To make sure people feel welcome and seen and like staff can relate to them and understand where they're coming from. Also, having diverse staff that's representative of the population served is super key, as well as language access, right? So I think whether you intentionally are hiring staff that speak the languages of the populations you're trying to serve, or you have a language access line, that's another big safety and inclusion measure. Another one that I would recommend, it's a really easy lift and it can have a really big impact, is using visual demonstrations of inclusive messaging, right? So a pride flag, a trans rights flag, a Black Lives Matter sign, all of these are flags to people that you're in a safe space, right? And, for me, I'm a queer person. When I see a rainbow flag somewhere, I'm instantly feeling a bit different, right, about that space. And so I think that's a way, if you don't have funding to build out a lot of these other recommendations, there are little things that you can do to change sort of the culture and the energy of the space to make people feel more welcome. Next slide, please. So, and I think Ashley touched on this pretty in depth, but, privacy is a fundamental right. It's a core need that we have, and the more privacy there is, and I think preliminary studies on non-congregate shelter really bear this out, the more people are willing to come inside. So thinking about ways within the limitations of congregate shelter where you can create more privacy, right? And I think, a lot of times that's a balancing act in terms of like safety and zoning and the layout of your shelter and all of these things. But, things like getting room dividers would fit under the shelter operations line item for ESG. So really thinking of like, are there small ways that you can create more privacy even in a congregate space? Also thinking about lowering barriers. So as we mentioned, pets, partners, possessions, making the space as accessible as possible is going to bring more folks inside, and implementing policies. And this kind of gets to the harm reduction aspect that screen people in rather than out. And I think another part of that that Ashley started to touch on is thinking about focusing on rules regarding behavior as opposed to substance use status, right? So often the concern of people drinking or smoking weed or doing drugs in the shelter is that there's going to be a behavioral, consequence of that, right? But in a scenario where someone is drunk and punches someone, the big problem, right, is that they punch someone. So thinking about policies that look at that behavior as opposed to the substance use itself, I think can be really impactful and again, act as a pretty significant lowering of barriers. Ashley, I see you came on camera. Did you have something to add?
Yes. So we had a comment in the chat about visitor policies with a question mark. So I'm wondering if maybe you could touch on that. And Donald, you may want to touch on this as well from your experience in Orlando.
There's also a question right before that, and it's how does housing and support provided relate to county general assistance grants to individuals? And so I don't know, Nora, if you wanted to touch on that, and I'm happy to talk about the visitors.
I think if you're talking about the county GA programs, I think that maybe I'm not sure who that question was from, but if you want to come off mute and give us a little more details about what you're looking for. I think GA programs vary pretty widely from county to county. And I would say that, non-congregate shelter or congregate shelters should, as much as possible, be connecting people with the local benefits that they're going to qualify for. But I don't know if that answers your question or if you're looking for something more specific.
It comes very close to that. This is Jerry Lalonde. In California, each county has their own GA program, but the benefits that are received by getting housing affect the GA, and the GA is generally very low. And so I was looking to see if anybody had negotiated with their county so that the GA benefits would not be reduced simply because they were getting housing and or these other resources that are counted towards the GA value of it. It may be a bit too deep in the weeds, but that was my thought.
Yeah, I think those are, I know specifically for San Francisco and their GA program, it's pretty hard to get around that reduction of benefits if someone is sheltered or housed. But if anyone else has an example of in your community how you've worked through that issue, please feel free to come off mute or put it in the chat.
So addressing the visitor policy, so we were very stringent when it came to visitors policies, because we wanted to make sure that there was no exploitation and that anyone that wanted to interact with our clients was someone who was productive or helpful. So certainly there was a space. We had a visitor space where they were in direct sight of staff. And we could oversee the visitation, and that was not only from those who are maybe family members. We had a once a week time when we would have family members able to engage. But even with case managers, we had to see their credentials. We had to make sure that they were people who were there for a positive impact on the individuals. So that was a very particular subject with a lot of concern, making sure that there was no, again, exploitation or any negative consequences for our clients. So we actually suggested that if there was visitation, that it would be done off-site. But in cases where the person had a disability and were not as mobile, or there was the need for additional services, again, like job placement or case management, we did allow those individuals with the proper identification to enter into the space. So that's how we dealt with visitation policies And, of course, this is in a non-congregate shelter setting. Hotels always have a room or two where people could have those kind of interactions, but very limited, and no overnight stays in the hotels that we operated as well. So I don't know if others have experiences with visitation, but it's something that has to be really well managed.
Yeah, if I can just add to that, we've had some examples of where that has not worked out particularly well in California, and it's that people were coming in and staying in those rooms, which was causing, and then people were issues with noise violations and a few other things. So one of the things I would just say is it goes back to the comment I had earlier about a proper staffing ratio. What we discovered was that the folks were being put in non-congregate shelter and just being left there. And that's not how a successful non-congregate shelter program is going to run. You're going to want to make sure that there is staff there to address a variety of needs. But I see Amber came off on camera. So maybe Amber has a couple of comments as well.
Yeah, we actually do have a visitors policy. And so basically, in order for somebody to be an on-site visitor, we have daily visiting hours, Monday through Friday. And we have a very narrow qualification process. And so basically, we require at the site, due to our proximity to a couple of schools in the area, you cannot be a registered sex offender, you cannot be a registered arsonist, and you also cannot have outstanding warrants for some specific violence-related issues, violence or wobbler crimes. Some of those are misdemeanors, but so that's a pretty narrow qualifying piece for people to come in and actually live in the shelter. So we extend that same process. There's people come in, they report that they'd like to have a visitor cleared to access the site. They go through that same check down, and then they can come on site. Similarly, as Ashley mentioned, nobody's going in anybody's units. We have an outdoor community space. We have a community smoking area. But those visits are all done on site Monday through Friday. And, it can be a little bit difficult sometimes to manage, but I think that for us, it has worked out well because people have a way. We understand how social this population is. And so us to be able to support that. Also, for folks that have not yet come into shelter, this could be their opportunity to be able to come in and say, hey, this place isn't so bad. Maybe I want to consider coming in and consider a different kind of life for myself as well. So that policy for us has worked out very well. And so just want to provide, I guess, some positive encouragement if you can pull it off.
It does definitely go back to Ashley's comments. It really is related to having adequate staffing. If you can have enough staffing to be able to supervise those interactions, I think it's a good thing to definitely be able to do that. We had staffing, but not enough to do it on a daily basis. We had to do it on a weekly basis to make sure people, because the most important thing is we protect the safety of our clients. And there's a lot of predators out there, as we know.
Yeah, thanks everyone for sharing that. Super helpful. I think we can go to the next slide. Just wanted to highlight here, and I'm running short on time. I would love to hear more about this from you. Maybe we can do that in the chat. But I just wanted to underlie one of the biggest benefits of non-congregate shelter is connections to permanent housing for folks. And I think in talking to a lot of different communities that have had NCS projects, really that successful exit pathway to permanent housing comes from a couple of things, wraparound services, and being able to find people, right? Because you have folks centralized in a single area. You're doing ongoing service with folks, you're engaging with them. So really working the NCS projects as like a by name list, right? And housing people has been really successful for many communities. So we really want to encourage you, again, if you're not able to create an NCS project, really leveraging that knowledge and those benefits to create similar mechanisms for folks who are in congregate shelter or in encampment. So potentially having a by name list of everyone in a particular encampment, trying to work that by name list. We actually have in an earlier training, myself and a few other colleagues did a presentation on rehousing plans, which really gets at doing some of these things like 100-day challenges to have a targeted subpopulation and to do a big housing push for that population. So definitely check that out if you can. I also wanted to put in a plug. Myself and Chris Pitcher and a lot of other technical assistance providers are working on a project offering individual technical assistance to many COCs in California. So if this is something you're interested, if you're interested in doing a rehousing plan or standing up a new NCS project and you want help thinking that through, something that we can help with, then I will leave it to Chris to put the best contact information for that in the chat. So definitely reach out. Next slide, please. Just wanted to talk really quickly, and then I'm going to pass it back over to Ashley. But there's just a couple community examples of non-congregate shelter success. So I wanted to mention Napa, and we've definitely trotted them out for various presentations because they did really have an extremely successful NCS project in terms of getting people permanently housed and having a high level of consumer satisfaction from that project. They have a pit count of about 350 people, and they were able to house a pretty significant number of folks into permanent housing from NCS. And so that made a big impact sort of on their overall, the total amount of folks who were unhoused in their community. They essentially shifted their coordinated entry system to solely focus for a number of months on the folks who were in non-congregate shelter. And so basically folks would exit from non-congregate shelter to permanent housing, and then more folks could come into NCS, and they sort of worked it that way. And they had a number of really comprehensive wraparound services, including custodial, laundry, some security, support staff, sort of all the things that Ashley was mentioning earlier. Next slide, please. And actually, before I pass it over to Ashley, I wanted to mention too, because I know Jerry and perhaps some other folks were looking for some more research some more research has been done on the successes of non-congregate shelter. And so I just wanted to flag also Alameda had a pretty successful NCS effort during COVID. They exited over 1,700 people to permanent housing. And they participated in a study which essentially showed both improved health outcomes, improved satisfaction for residents of non-congregate shelter, and that folks from non-congregate shelter entered permanent housing at twice the rate of folks in congregate shelter. So just wanted to highlight that. That's something, a lot of information about that is publicly available. So definitely look into that if you're looking for more research information to bring back to your community. And Ashley, I will turn it over to you.
Thanks so much, Nora. So I'm going to give another example. This is not in California, but it's in Arizona. This is the Emerge Center, and it is a domestic violence provider that serves the greater Tucson area. Pre-COVID, they operated a facility that had both shared bedrooms and Jack and Jill style bathrooms. So what that really meant was about 8 individuals were sharing one bathroom and sleeping in bunk beds. So it was a very close quarters. And Emerge knew that this was not a trauma-informed approach or model, but they were really limited in making substantial changes to the building. But as you can think about, right, people in crisis are not necessarily their best selves. Being in crisis and being traumatized is incredibly exhausting and emotionally fraught in many ways. And so they were seeing that, frankly, they were spending about 80% of their time on communal living challenges and really only about 20% of their time on actual case management. So they knew that something needed to change. The other thing that they also knew from experience was that every disease spreads like wildfire because of the close quarters that they had. So there were issues with lice, There were issues with bed bugs. Of course, you know about COVID, and they had those same issues with COVID-19. So when, previous to COVID, they used hotels for overflow or in situations where the communal living just was not working. But when COVID hit, they knew it became impossible to mitigate the spread in their congregate setting. And so they moved to a solely shelter hotel program. So this cost roughly $93,000 a month for them. And they've been using hotels exclusively since June of 2020. Now, and they know that $93,000 a month for them is not sustainable, but that was what it took. And they were able to do that with a number of different funding sources that came from the CARES Act and the American Rescue Plan. So what's really interesting here is both of those funding sources really were the catalyst to help them think about converting their shelter facility into a non-congregate shelter space. So they started to have conversations, and the city was willing to pay for a feasibility study. And as I say here, then it was really off to the races. But what the executive director shared was that a total conversion of that space was possible because of the influx of COVID-related funds. It was not feasible prior to this. So they used an architect that had been in the community and had been working with the municipalities and nonprofits. So they knew the folks to bring to the table, and they started to have those conversations. The original price of the total conversion was $3 to $3.5 million, and that included money from Home ARP, both from the city and county, and they actually were able to secure $1 million from one of their foundation supporters. This had been a consistent funder, and they offered a challenge grant. So if the agency was able to secure the other funds, that $1 million came in. So they had the ability to demolish the existing building and build a new one from the ground up. Now, I want to say, I'm moving through these slides really quickly, so it sounds like everything just went smooth. But if any of you have ever built anything, you know that there were lots of bumps along the way. So securing this money took a lot of time and a lot of politicking locally. So let's fast forward to 2023. Let's not talk about the economy and inflation. You all know what's happening. You know about those supply and labor shortages. Construction price went from $3 to $3.5 million to $7.5 million in just under a couple of years. So they now had to secure basically double the amount of money that they thought was going to happen. So they had to secure money from the state. They were able to get a state senator who was also a survivor and a real advocate for the domestic violence community to advocate for additional budget line items. And they were able to secure a significant amount of money from that. They had another private foundation who was able to give a big gift. And then they tapped into their own rainy day fund. So I want to be super honest here. They had to go into their own supply, which they kept just in case something happened, because they knew that they had to invest this money to be able to get the building up and running. So they are in the process of building right now, and you can see what this is going to be looking like, the before and after. There were shared units that were 13 in number. Now they have 25 studio apartments. Those studio apartments can be shared, but they do not have to be. And they were able to increase their beds. They were able to have private bathrooms. And they've been really thinking about how to incorporate community space to mitigate that isolation. And I think Amber made a couple of comments about that and what they're doing in their space. I know Nora talked about it too, but just really trying to think about how to minimize isolation when people are in private households. Okay, With that, I'm going to go over a couple of other things that Nora started to talk about as we think about if you are not able to have non-congregate shelter, what are some of the ways that you can change your congregate setting to feel more like non-congregate. So one of the things that can be done is to create some isolation and quarantine spaces, or let's just say private spaces that can be flexible in nature. So they could be used for isolation and quarantine. They could also be used as detox rooms. They could be used as medical respite, or for lactation rooms for moms, or for a number of moms to come in and sit and have a conversation while they are breastfeeding their children. So there are a lot of ways that you can have one space that serves in a very flexible manner, and that's something to consider. One of the shelters that I've worked with throughout COVID finally built out their second floor. So their first floor is congregate, their second floor is all private bedrooms for larger households. So again, there were and there are funds to do that, and you can really think about what that looks like to make your congregate more non-congregate. The other thing to really be doing on an ongoing basis, and this is where I want to go back to something, or to what Donald was really sharing earlier about one, getting feedback, but incorporating the voices of people with lived experience. You all need to be, as shelter providers, looking at your policies on a regular basis and getting feedback on those policies and thinking about ways in which you can deinstitutionalize those policies. We have all had conversations with shelters that really feel like prison, and I want to call that out. I'm not suggesting that anybody on this call is doing that, but I do know that I've had a lot of conversations with shelters across the country where it feels very much like an institution and not like a place for healing and safety. And so in any way that we can create policies that are non-congregate in nature, are humane and dignified in nature, to really have an ongoing feedback loop about our policies and our procedures. And then think about how you can transition congregate space to non-congregate rooms. And it may not be immediate, but it could be over time. So thinking about putting together a funding packet of what you would need in order to do that. So again, keeping your options open. Would love for people to put in the chat any comments that they have done to really move their congregate space to a more non-congregate space. And with that, I'm going to turn it over to Donald, who's going to handle some Q&A.
Thank you, Ashley. And wanted to talk about really quickly before we go into Q&A, two other kind of more elusive targets for funding, but ones that people have utilized in the past and you may want to consider. There's Title V of McKinney-Vento, which allows for the use of decommissioned government properties as use for homeless shelters. And there are examples in California where Title V has been used. One is Alameda Point Collaborative, that the use of that old base as permanent supportive housing is pretty remarkable if people don't know about it. There's also the idea that is emerging in California through former Congresswoman Hilda Solis and some of the work she's doing in Los Angeles. There's adaptive reuse of either state, private, or federally owned properties into housing for people that are experiencing homelessness. It's something that the mayor of Washington, D.C. has really talked about in terms of for-profit properties, but can also be utilized for housing people with lived experience. If anyone has questions, we are certainly open to answering those. I know we've addressed many in the chat, but love to hear a couple of you maybe come on camera and ask questions directly. Or you can put them in the chat if you don't want to talk out loud. Go ahead.
Donald, one of the things that came up in the chat privately was around staffing. And I know I talked about some staffing considerations, but I think I just want to say here that if you have models, this non-congregate shelter model means that you need to have adequate staff. If you cannot do that well, you really need to think about whether or not you will have a successful non-congregate shelter. And what I mean by that is you do have to have people, which means you have to probably increase your pay. That means you need to be thinking about other folks, such as temp agencies and other people who can come in and provide support, so that there are people there that are trained, right? So that means you have to put money into training and ongoing training to ensure that people are going to continue to provide services in a trauma-informed way. But I just want to say that while we are saying that we really like the non-congregate shelter model, if you're just going to put people in a hotel and walk away, that is not successful. And we've seen that happen time and time again. And so you have to think about all of these different components to have a successful non-congregate shelter intervention. So just kind of wanted to put that sort of warning out there.
Excellent point, Ashley. And I would also include, in addition to the other places where staffing might be available, please consider the population that you serve, people with lived experience. I kind of brush over a little bit the idea that a mentorship program is really effective. In my many different kinds of programs, I've been doing this for almost 30 years. One of the other programs, the 400 hardest to serve in Orlando, one of the most important components in that program, we house people who had 20 to 30-year histories of being on the streets of Orlando. One of a really important component of that was a peer support component. And also, just having the number of staff and services that really are best practices, smaller caseloads, the entire ACT team, and we certainly understand the difficulties in getting funding for services, but to the best of your ability, cities have their own dollars, states have their own dollars, Medicaid, for those who've taken on the Medicaid expansion, there are dollars there to provide services. So all of the work here has to be done in a creative way. We've offered some examples of how you can do it, and certainly it becomes harder as we work with a challenging but getting better economy. But there are ways to do it. We hope in our upcoming sessions to provide you some other examples. One example that we're hoping to get for you is Denver, Colorado, which has used the non-congregate model as the predominant model in that community, and really done some collective things about funding that we hope to bring to you. But there are many examples of this, but it does require both the commitment and also the creativity to be able to pull it off. And hopefully we can show you examples of that. Nora, I see you came on camera. I don't know if you had a comment.
Nope.
Okay.
Just waiting, just here to answer questions if people have any.
Don't be shy. I'm sure you have things that you would want us to explain in more detail, or things that we haven't covered that you'd like for us to cover. There's a couple of things in the chat. Well, one person was saying that Nashville used a decommissioned school for their IQ site, I think that says, and Jacksonville used a not in use building. And again, those are the kind of creative things that we're talking about. Cities have these properties. I'm telling you, there's tens of thousands in every community that could be utilized. And so again, it requires a lot of commitment and ingenuity. If you'd like us to take a deeper dive, oh, I'm sorry, that's one of them. Can you talk about partnerships? And Ashley and Nora, and then Nettie Jackson has her hand up. Let's talk about, let's go to Nettie and then we'll talk about partnerships. Nettie, you had a question? We can't hear you if you're talking. You may be still on mute. We're starting to hear you. Did you change something?
Yeah.
Okay, there we go.
I'm from the city of Victorville, and we're getting ready. We're in the process of building our wellness campus here that should be ready by hopefully July of this year. We will be housing up to 170 people, 110 doors that will be inclusive of some families on campus, non-congregate living, recuperative care as well. And so this is a big project for us here for the city. And my question is, like, we understand the importance of security and having staff be a part of that and everything, but what are some ways to like monitor like at night? What is supportive techniques or tools that people have used to help monitor campus at night, or bed checks or anything, especially in a non-congregate style of living?
Sure, I can go into that, or Ashley or Nora. We certainly we increased the number of resident managers over the night. We also had a locked facility. So there was a gate around the entire facility. And if you came on to the campus, you had to be led onto the campus. Okay. So we were very intentional about making sure that only those people that were residents were actually able to access the facility, especially at night. Those gates were open during the day, but at night we wanted to be very protective of our residents. I don't know if Ashley or Nora, and then we only have a couple more minutes, but would love for you to address that if you have any ideas or thoughts.
Yeah, one thing I've just thought very quickly, and I know Nora, you're going to say something too, Ms. Jackson, is I don't know if you're already serving people who are experiencing homelessness, but it would be really helpful to have some conversations with the folks who are going to be living in that location to actually talk through what feels appropriate and safe for them, because part of what we're trying to do here, right, is deinstitutionalize all of the things we've done and treat people as adults. And so it may be some give and take, but I think having, and maybe to Donald's point, thinking about who can be there 24 hours a day in the evenings, not only for crisis management, but just as additional eyes and ears, right? To just make sure people are doing okay. But again, we're trying to think about how we are giving people more autonomy and giving people more power. And that's going to take a little while. So I would really love to actually, or I hope that you are able to have some focus groups to talk through how would people feel safe at night in those settings, and what would that look like?
And if you approach it, I'm sorry, and Nettie, I was just going to say, if you approach it from a protection standpoint versus a security standpoint, it makes a lot of difference. If you share with your residents that what you have in place is for their protection and not their incarceration or institutionalization. We need to go to Chris. But in terms of partnerships, I'll just say this one thing really, really quickly. One of the most effective partnerships is with FQHCs, federally qualified health centers. What I've seen across the country is if you partner a healthcare for a homeless facility with housing providers, those are amazing programs because they bring all those resources that are supportive to the table. So Chris, to you.
Thank you, Donald, and thanks to Ashley and Nora for that great presentation today. I'm going to run through a couple of slides before I do my closeout, because we do have 2 more slides. So here are some resources that are available, and you will get these emailed out after the session for you to go further into. And last but not least, we are doing another session on the 14th, prioritization considerations for limited non-congregate shelter. Here is a registration link. We're also doing another session on the 21st, and you've heard Nora ask a few times if you have comments or topics for us to cover, please let us know. I did see rural as one of those topics that was put in the chat. I did not see them all. But we do have 3 sessions on non-congregate shelter that we're going to talk through in the next couple of weeks. So we hope you will continue to join us. With that, I want to thank you all for attending this California Housing Community Development Community Workshop offered through the Emergency Solutions Grant Coronavirus Relief Consulting and Staffing Services Contract. Look out, please join us for the next few sessions of this. We also have the rest of our year kicking up. So I did put the website in our training website in the chat at one point. There will be a short survey that pops up after the session. Please do fill it out. We actually do adjust sessions based on your comments, thoughts, and concerns. So please take a moment to do that and enjoy the rest of your day.